prostate cancer is very, very important. So I'm glad that the German Development Corporation, together with Bayer Pharmaceuticals AG, see this national dialogue as an opportunity to partner with the Ministry of Health, with the Ghana Health Service, and all other partners to the critical need of improved awareness, the early detection, which we heard is so important, and of course the comprehensive management overall of prostate cancer. This dialogue today aims to promote on the subject matter of prostate cancer the stakeholders gathered here in this room, and thank you everybody for coming here and for contributing to a vivid discussion and exchange. This is a significant public health concern, and this is something we have to work on. In March 2022, so more than 2 years ago, Bayer AG, the pharmaceutical giant, and the German Development Corporation initiated this prostate cancer project in Ghana with the name of Piloting Prostate Cancer Intervention in Greater Accra Region. So the objective is to improve the access to prostate cancer specific antigen, PSA, I'm also learning about this now, testing and preventive healthcare services in selected communities in Greater Accra. The project is working in collaboration with 8 health facilities in Ghana, and over the past years we have been already raising and promoting early detection. It's a long way forward nevertheless, and I suppose after today's dialogue we will have more solutions how we can boost this awareness, and of course also this idea of promoting early detection. We have furnished the facilities with PCA testing devices, trained lab technicians, and we resourced wellness clinics for these 8 facilities. So now we are hoping that with education, communication and information, the materials for public education and sensibilization will be distributed. It's our hope with this dialogue we will usher in an area of increased public and professional understanding. German Development Corporation, as Gia said, and of course on behalf of our German ministry, we are passionate about collaborating with the government of Ghana and the private sector to strengthen Ghana's health system through diverse ways. Thank you very much. Medasipan, and a good day.
Thank you, Ugo. Alright, so I would like to state again that this program, the German Development Corporation, and it's funded through, developed on behalf of the German Federal Ministry for Economic Cooperation and Development. The project is in collaboration also with Bayer Pharmaceuticals. Alright, so we shall have a 2-minute video by Bayer Pharmaceuticals, which will be delivered by Mr. Ingmar Strauss. He is the Bayer AG CEO.
Today, on behalf of the entire Bayer team, gratitude for the progress made in the past 2.5 years. The important prostate cancer initiative in Ghana started long before the Global Health Unit was established, but highlights nicely one of the objectives we seek to achieve: improved access to prostate cancer testing. Improving access to early detection of prostate cancer for roughly 200,000 men in the Greater Accra region is a great accomplishment. We all know that prostate cancer patients in Ghana are usually diagnosed at late stages of the disease. Therefore, it was and it will be important to strengthen the capacities for quality prostate cancer services. In this regard, we made good progress. 30% facilities were successfully trained. 8 district hospitals were equipped with devices allowing for PSA testing. 40 participants from hospital laboratories were trained in quality PSA testing. And training material was handed over to the Ghana Health Service. I'd like to extend a heartfelt thank you to the Ministry of Health, the National Health Insurance Authority, the Ghana Health Service, the private sector, and civil society who teamed up to jointly drive progress. I firmly believe that your drive, passion, and unwavering focus help to sustainably strengthen the capacity and future initiative in prostate cancer in Ghana. Let's build on the learnings moving forward. I wish you all a great prostate cancer dialogue and fruitful exchanges that can help to further bridge the gap in prostate cancer care. Let's stay in touch, and thank you again.
Thank you, Mrs. Strauss. Right, so in a few minutes' time, we'll have a coffee break. We'll take some good photos and so on. But at this point, we are going to have the keynote address. The MOH action regards prostate care in Ghana and areas to pay attention. The Deputy Minister of Health. Shall we receive her with a round of applause?
Thank you and good morning, everyone. Nananom, Professor James Mensah, the Chairperson, Representative Parliamentary Select Committee of Health, Representative of Chief Director, Ministry of Health, Representative of Chief Director, Ministry of Finance, Directors of Ministry of Health, heads and all agencies, representatives of the development partners, representatives of CSOs and NGOs in health, health sector stakeholders present, distinguished friends from the media, ladies and gentlemen. I would like to express my profound gratitude to the diverse stakeholders gathered here for this National Prostate Cancer Dialogue. To me, this shows our committed effort to addressing the challenges posed by prostate cancer in Ghana and how the health of men is dear to us. As many of you know, in 2022, 1,467,054 new cases of prostate cancer were recorded around the world, making prostate cancer the 4th most common cancer worldwide. In Ghana, it is one of the top 2 reported cancers in men. It affects thousands of our fathers, brothers, and sons. Yet, it remains a silent burden. Despite being preventable and treatable, many cases go undiagnosed until they have reached advanced stages, leading to poor patient outcomes. This is one of the gaps in care we are confronted with the sector and answers why we need to take collective actions and mobilize our efforts to address the challenges addressing prostate cancer care. I wish to use this opportunity to commend the Ghanaian Development Cooperation and Bayer Pharmaceutical for convening this National Prostate Cancer Dialogue and for initiating the prostate cancer project called Piloting Prostate Cancer Intervention in the Greater Accra region. aimed at raising public awareness of prostate cancer, promoting early detection of the disease, and advocating for the stakeholders' strategic dialogues to develop policy recommendations and strategies for prostate cancer care in Ghana. The landscape of prostate cancer care in Ghana is riddled with significant challenges, many of which we must confront using multi-sectoral and multifaceted approach. One, there is a general lack of understanding among the public about prostate cancer, its risk factors, symptoms, and importance of early detection. Microceptions persist, which prevent men from seeking timely medical advice and screenings. Although prostate cancer is a treatable and when detected early, access to screening services, innovative treatments, diagnostic equipment, and affordable medication remains limited. This is particularly concerning in rural areas where healthcare facilities are often under rate. Number 3, additionally, financing for prostate cancer diagnosis and care is also a significant challenge which requires our collective support. Number 4, moreover, reliable, up-to-date data is essential for informed decision-making. However, Ghana lacks comprehensive prostate cancer data, which hinders our ability to design cost-effective innovations. For effective civilian monitoring and evaluation of cancer trends in Ghana, to make informed, evidence-based decisions, we must invest in systems that allow for the timely collection, analysis, and dissemination of prostate cancer data. This will ensure that interventions are data-driven and responsive to the needs of our populations. Number 4, invest in cancer diagnostics and treatment. Expanding access to diagnostic equipment and cutting-edge treatment options is the key priority. We must ensure that healthcare facilities across the country are equipped with the tools necessary to detect and treat prostate cancer early. Number 5, support capacity building for the healthcare workforce. By building and maintaining a strong, well-trained workforce, we can improve the quality of care available and reduce disparities in health outcomes. Ladies and gentlemen, achieving universal health coverage and meeting our SDG targets requires a coordinated, multi-sectoral response which requires the active participation of every stakeholder in collaborate more closely and work towards these shared goals. As already mentioned, it is very important that interventions we are going to propose today and are legend with our national priorities. This will ensure our streamlined and impactful implementation of those interventions, helping to avoid duplication in efforts and wastage of limited resources. In conclusion, I would like to ensure all stakeholders gathered here to the Ministry of Health is committed to doing its part and your support to ensure that every man in Ghana has access to the care and support he needs to prevent, detect, and treat prostate cancer. I thank you for your attention.
Thank you very much, Honorable Abby and team. In fact, there is no woman who has been diagnosed with prostate cancer before, but we are always happy when women are part of prostate cancer discussions, because we know that the health-seeking behavior of women is way better than that for men. So we are really glad that you've taken up this challenge that will help with the policy when it comes to prostate cancer care in Ghana. At this juncture, we are going to take a group photo. And so the cameraman, the GI